Welcome to Beauty Talk with me, Cindy Nell-Roberts, and my beauty bestie, Denise Simba. With a list of qualifications so long, I actually have to write them down and read them. We have two experts in the house that is going to share such interesting information with us today. Dr. Vincent Ehlers, internationally published author in hair transplants with a master's degree in hair transplants and hair transplant management, here to talk all things hair transplants. You no longer have to go to Turkey.
Yes.
You only have to go to Durban. Welcome, Dr. Vincent. Thank you for joining us. And keeping it in the family, Dr. Francois Ehlers, with a postgraduate degree in aesthetic medicine, a focus on intimate and sexual health and aesthetics, also all the way from Durban. Dr. Francois is here to talk intimate health, sexual health, and aesthetics with us. Welcome, Dr. Francois.
Thanks for having us, ladies.
Thank you for being here. Let's start at the top. We'll start with hair transplants. Vincent, I believe that it is gaining popularity at a rapid note.
This is true. I think hair restoration and hair transplant specifically is booming at the moment. There's a lot of things that contribute to this. One, I think that social perceptions around the acceptability of having cosmetic procedures done is busy changing, and people are also becoming a lot more aware that there are available solutions. This is contributed to by either celebrities or just normal people sharing their journeys and us having access to this on social media platforms as well as YouTube.
I imagine that it makes a big difference in your confidence if you are worried about your hair. I mean, this wasn't available to us in the old days. So your only choices was, as far as I know, shampoos or basic treatments. And now it seems like it's starting to become commonplace. If men don't like their hair or women don't like their hair, they can just go in for a transplant. How long does it take? How long is the recovery period? And how long does it last?
So there's a few elements to that, so let's break it down one at a time. I definitely think that it does make a big difference to someone's confidence. You know, we're so used to going for procedures that are no longer taboo. For instance, you go for braces to straighten your teeth, and that's not really looked at or frowned upon. And now this is just one more element to making sure that you're comfortable in your skin and you can kind of present the best version of yourself. In terms of the hair transplant, it is a little bit of a process to go through. A procedure itself can take anywhere from 6 to 9 hours, depending on a few factors, how challenging it might be to extract it, but mostly around how large the area is that we need to provide coverage for. The results after a hair transplant also require a little bit of patience. There's no instant fix to it, but anywhere from about 4 to 6 months after the transplant, you'll start seeing some new growth develop, and this progresses month by slowly getting thicker up until about 12 months after the surgery.
That is then a permanent result, right?
This is true. So the hair that we use for hair transplant is going to grow permanently, and this depends on where you're taking it from. The most common sites would be the back and sides of your scalp, because these are resistant to a lot of the types of hair loss that you experience, most specifically genetic hair loss or hereditary pattern type loss. And there's a concept known as donor dominance, which means wherever you take the hair from, the hair is going to retain all of those characteristics when you place it into the new area. But we need to remember that where you take it, it's not going to regrow in that area because you're actually extracting the root of the follicle. It's going to now grow where you end up placing it.
And what are the factors that contribute to hair loss, especially like for men when they're like balding?
So we can break this down into a few different categories. So mentioning men, the most common one would be genetic or hereditary. And this is usually due to a predisposition or sensitivity to sex-related hormones, so a compound specifically known as DHT. This can play a role in female pattern hair loss, and how you know if this is what's impacting you is the hairs on the back and sides will be spared, but the hair on the top of the scalp is usually a bit more sensitive to it. Other than that, you get immune types of hair loss, or a common one known as alopecia areata. This is when the body will actually attack the hair follicles, and you might lose them in specific areas that are haphazardly scattered around the scalp. Beyond that, you've got medications or medical conditions that can also contribute further to hair loss. One of the very common ones would be iron deficiency. and then you get the nutrient deficiencies beyond that. Those often affect hair in more of a global fashion, where it's not just the top that's impacted, but the sides too, and even potentially facial or body hair as well. So it always starts with a good consultation and really a thorough look to determine what type of hair loss are you experiencing, and is this amenable to a hair transplant, or does this require a non-surgical means of solution?
And what would be your non-surgical means of solution?
There's a wide variety of them. Shampoos, for instance, if it's related to scalp health, if there's irritation or inflammation on the scalp, tend to believe those treat that quite well. You can dermaroll, which is a small device with little spikes on it. It causes a little bit of irritation in the scalp, releases a few natural growth factors and gets blood circulation to the area. Then in clinic is where we provide a little bit more of an in-depth solution, and there will be prescription medications depending on what the cause might be, common ones being minoxidil or finasteride when it comes to male pattern hair loss, and then the procedures itself, common ones being PRP, which stands for platelet-rich plasma. We have microneedling, there's laser light therapy, and newer treatments such as stem cells or exosomes. So there's a lot of variety available for treating the hair loss, and we try to tailor this according to what it is that the patient needs, the extent of hair loss, and of course their budget. And there is something that can fit into any range that the patient fits into.
So for coarse people's hair, there is seems like it's a misconception where I've heard that it's important for us darker skinned to apply a lot of oils for hair growth, where I'm starting to read up and realize that maybe that's not the case, that too much excess oil kind of clogs the hair follicles. Is it a yay or a nay? Would you agree with that?
So I think you need to feed hair what it needs. Mm-hmm. So if you have dry hair, dry scalp, or a fragile texture to the hair, mm-hmm. then more oil would be required. It's the same as supplementation. Mm-hmm. I think by nature of the word, it means in addition to. So I wouldn't add anything that the hair or scalp doesn't need, but you need to pick what are the factors that are missing. And if you apply that to the hair, and it wouldn't have to be daily necessarily, mm-hmm. but as and when needed, it can contribute. A very popular one that's going around as a bit of a trend would be rosemary.
Yeah.
Rosemary leaf extract, and that's because of an article that's come up comparing it to minoxidil in a lower percentage. So there are definitely oils that can contribute to improving it, but over application, I think you're right, this is going to impair the normal balance of the skin and the scalp, mm-hmm. and can contribute to clogging the area.
Okay, noted.
So what I took away from earlier conversation with you is that the hair follicles are taken out one at a time and transplanted. So you don't really see what is taken out on surgery, where it's taken out. Is that correct?
The balance when it comes to a hair transplant and the decision that you need to make is how much available healthy hair is there, where you can still extract enough to provide the patient with the coverage they're looking for, but maintain undetectability in the procedure. And that's truly the art that's behind it. In the more modern method known as FUE or follicle unit extraction, that's how it works, where with a tiny punch, my preference is 0.7 millimeters, one by one we extract hair follicles, and we leave healthy hairs around this area. So when they grow to a length of about 1 millimeter or 1.5 millimeters, they hide the fact that we've taken hairs. Its limitation, though, comes in if you don't have enough healthy hair in the area and you have to extract too many hairs. Well, we just don't, because then it can actually be apparent that the procedure's been done. And this is compared to the older method that was available, known as FUT or a strip surgery, where they're actually taking a section of scalp from the back and side, then suturing this closed, and obviously when the skin closes, it's going to leave a visible scar, making short hairstyles not really appropriate, or if you want to hide visibility of it.
Could you take a different hair type, texture, and implant it in, let's say, for my hair? So, for example, I want to look like a Puerto Rican princess.
And, you do already.
Oh, thank you. And I want to have that hair texture as like my new phase in my 40s and 50s. Could you do that for me?
You're going to be in your Puerto Rican era.
Yes.
So unfortunately, that's not possible at the moment. So the hair follicle has to be what we call autologous, which means it must come from yourself. It is human tissue, so it would have to match. It would be the same as getting a random organ transplant. The body would reject that.
Okay.
But you're already beautiful, baby. You don't need new hair. Dr. Ehlers, just to wrap up, what is the price tag on hair transplants, roughly?
A hair transplant ranges typically from about 50,000 up to 100,000 Rand for a procedure. I know that seems expensive, but this is a permanent procedure, and if you take the right steps in order to preserve the existing hair, you're going to have this result forever.
And it is life-changing.
I want to ask
seen that.
one more question, though. Let's say I want to get a hair transplant, but I don't have enough hair on my head. Can you take hair here, here, anywhere to put it here so it grows? Because I'm sure you have clients that want the procedure, but like you said, don't have enough hair on their head to take out and then place where it's needed, right?
That is possible, and that's what the FUE versus the strip allows for, is any body region could essentially be harvested.
Okay.
Doesn't mean it's ideal to do so because visibility of scarring can be more complicated and the healing, but common other areas for hair to be taken would be from facial hair, the beard, or possibly the chest.
Okay.
I wouldn't go and use that and put it in the front of someone's hairline because, again, it's going to grow as chest hair where you place it. But it is possible for filler hair in between.
Oh, okay.
On to you, Dr. Francois Ehlers, talking about sexual and intimate health. I think let's jump right in. What are the most popular treatments that you are currently doing in your clinic? Shall we start with aesthetic sexual treatments?
Sure. I mean, and I think that's where you can look at it. You can look at it as aesthetic and you can look at it as functional. If we're talking about men, the most common aesthetic procedure is a penis enlargement using dermal fillers. And then for ladies, it would be either a labiaplasty or labial augmentation using fillers as well. And when we talk about the functional aspect, in either it includes PRP therapies. In men, we call it the P shot. And in ladies, we call it the O shot. And then with ladies, we also have laser vaginal rejuvenation as well.
Okay, so many questions there, but first tell us exactly what is a P shot and an O shot.
These terms have been trademarked by a doctor called Charles Runnels, who initially started using these therapies on himself and on his wife. PRP technology is not new. It's been used for a very long time by dental practices. They inject it into gums to help healing. Orthopedic surgeons inject it into joints to help soft tissues. And you even have vets that inject it into horses if they've got injuries. So we've just been leveraging this technology of healing in these instances of sexual dysfunction. In essence, we take some of your blood, usually about 15 mils. We spin it in a machine called the centrifuge. And the gravitational force of the centrifuge will separate the blood into different components. The red cells in your blood we discard, and then we harvest what's called PRP or platelet-rich plasma. You can think of it as liquid gold, right? This is where all the magic happens. It's essentially a condensed layer of growth factors, and those growth factors help with healing and rejuvenation. In essence, what we're trying to do is stimulate blood vessels, and if we use the instance of a man, the more blood vessels, the more blood flow, the better the erections. So this is where these therapies have their benefit.
And essentially, the outcome of the therapies is then to enhance your sexual pleasure.
Absolutely. So, when we talk about sexual pleasure and arousal, it's also important to understand that it's quite a complicated process, right? There's a whole lot of factors at play. There's this physical component, right? You have to be attracted to the person that's sitting across from you. There's an emotional component. There's a chemical or a hormonal component, and then there's a psychological component, right? And if one of those factors are out of balance, then it can have this ripple effect. So once again, it's always important to have a thorough consultation with your patient to make sure it's not an underlying reason for dysfunction. And, this is something we're seeing more commonly. Young gentlemen coming through dysfunction, living crazy, high-paced lifestyles, and oftentimes it requires them just to figure out that maybe some meditation, sleep, and sun is what they need.
Yeah.
And I mean, women have been doing aesthetic treatments for years. So I suppose it's just an extension thereof, as hair transplants, for example. If you would like to have vaginal rejuvenation or a penis enlargement, it is perfectly normal that you would like to enhance or change that part of your body. And we see that it is gaining normality. But how do you create a safe space for people to talk about it, to visit these topics?
There's a lot of skepticism and stigma around intimate healthcare. I think women specifically have gone and normalized all sorts of augmentation to improve their beauty and allure, whether it's, treating their lips or augmenting their breasts or sculpting their buttocks. And now men are finally, feeling accepted that they can do the same. It's important to understand that confidence isn't gender specific, and there are all these ways that we can go and improve confidence and build it from the ground up. Society has unfortunately placed a lot of, I think, stress on men and trying to create this picture of masculinity, both in and out of the bedroom. So it's important to go and broach that topic by creating a safe and respectful, non-judgmental space for men to talk about these kind of treatments and to let them know that it's actually normal.
So what would be the process of like a penis enlargement, like in terms of the procedure, then how long it takes, and when we can use it again?
That's the most important question for the men all the time. Not is it going to hurt, when can I use it?
Just for my brothers and, out
Asking
there.
for
Asking for a friend.
So it's a great question. It's a relatively simple and straightforward procedure. It takes no more than 45 to 60 minutes, and that might include the consultation. Just like how you'd go to the dentist, you'd get some local anesthetic. That makes the procedure exceptionally comfortable. We take hyaluronic acid dermal fillers, the same that we use in faces, and we just use significantly more.
And it's important to note that this already is made in the body.
Absolutely. So hyaluronic acid is a natural substance. It's found in your eyes, your joints, and your skin. Its main responsibility is to moisturize and to hydrate, essentially. And we can use these dermal fillers to create volume. And we have body-specific fillers that we can use as well that are safe for all forms of augmentation, but specifically genitals. I use about 10 mils in the first session for safety reasons. You can add more, but usually we allow swelling to go down first. When can you start using it?
Yeah.
I usually advise about a week or so of taking it easy. Right?
That's quick, though.
It is. There's a small degree of swelling. We primarily want to prevent infection, so it's more of a precaution than anything, not to say that it's not functional.
Yeah.
And speaking about function, we actually stay very far away from the erectile tissue. So it will never affect function in that way. It's purely a cosmetic thing.
And then is the process permanent, or you would need to do a top-up?
The safety element of this procedure comes in when we say it's not permanent.
Okay.
Fillers, especially hyaluronic acid fillers, are reversible. In our body, we have natural enzymes that can break down hyaluronic acid, but we can also have them dissolved if outcomes are unsatisfactory.
Okay.
Vaginal rejuvenation, if you would like to aesthetically enhance the appearance of your vagina, what is the process from beginning to end? First, a consultation. How long does is it laser treatment or surgery?
Yeah.
How long does that take, and is it permanent?
So female genitals come in all kinds of shapes and sizes, so it's important to let all ladies know that it's normal, no matter what it looks like, and that just makes you unique. However, once again, society has created these harmful comparisons of what they should look like. And nonetheless, there are things that can be done. Surgical permanent solutions include a labiaplasty, which is essentially removing excess tissue. We once again can fill the outer lips, so labiaplasty specifically for the inner lips, and we can fill the outer lips in instances of atrophy or when there's been a loss of volume. And laser rejuvenation is more for the inside. So we use these laser technologies, or we call them energy-based devices, to essentially stimulate collagen, and that strengthens the supporting structures of the vagina. It can improve things like lubrication, sensitivity, pleasure, tightness, and even treat chronic infections.
Have you ever had clients, like for example, male clients that are just excessive about the size, where you would have to go, easy, tiger, not too far?
Fortunately not.
Okay. Is it because they're scared or, feeling a little bit embarrassed or shy that they're even at your practice to kind of get some sense of assistance help?
I mean, there are patients that have a sense of, I wouldn't call it embarrassment, but they are shy because they're not aware that it's a common problem. And majority of the men that come and see me are very normal in size. It's not that they are on the lower end of the spectrum. Everybody just wants to feel good about themselves. And unfortunately, it can become obsessive if that's all you can think about. We always work safety first. And allowing them to understand that more can look unnatural is also important, right? And once they understand that, they will understand our treatment recommendations and kind of where the line is to stop.
Well, I think it's so important that now we can very normally talk about the fact that beauty is no longer just about treating your wrinkles or enhancing your breasts. It really is about what makes you feel beautiful, whether that is hair transplants or genital rejuvenation. And I love that we are creating safe spaces to have those conversations, and whatever makes you feel good, whatever makes you feel that you look good. So incredible work that you're doing, Dr. Ehlers and Dr. Ehlers.
Appreciate it.
That is it from us at Beauty Talk. We'll see you next time.